Tzipi Strauss. And Tzipi is the head of the longevity center in the Sheba Hospital in Tel Aviv. I think very interestingly as well, she is a neonatology expert. So I think when we're looking at a longevity conference and aging, we're assuming that we're going to be talking about older people, but there is obviously a lifelong component to managing and optimizing our health. And I think this will be an interesting and different perspective in that we're going to hear from someone who is looking from the very earliest stages of life and how we can impact our longevities. So without further ado, if we could give a hand for Tzipi, please.
So thank you very much for the introduction. Indeed, as mentioned, I'm a professor of pediatric, and I would like to have you a little bit a different scope or extend the way we look at longevity. So I'll start with Daniel. Daniel is a preterm baby that was born in my department where he was 31 gestational age. He was actually born to a mother who has hypertension, so that's why he was born with 1 kilo, 100 grams, and this is what we call small for gestational age, or he had intrauterine growth retardation. Actually, his hospitalization was quite fine. He was discharged around 2 months at almost 2 kilo weight, his weight, and his neurodevelopmental follow-up was actually very good. Now, when he was around 18 years old, he was being checked, and actually what we saw is that he had hypertension, his hemoglobin A1C was quite high, and his lipid profile was high, and actually he has started his metabolic syndrome. So what can we learn from Daniel and from these babies and the preterm and actually from infants? So a big study that was just published not long time ago in 2024 in JAMA that was on almost 5 million children, babies in Canada, that was looking for the preterm mortality in adulthood, and that was until the age of 36. And you can see here that what they showed is actually a higher risk of all-cause mortality, and it was in every decade of, like as you see here, the first 5 years, the next decade, and the decade afterwards. Another study that was just published was looking at, again, the different mortality at the age here around 40, 45. And the black line you can see here is a term baby. And all the yellow, blue, and green are babies that were born between 27 weeks and below 37 weeks, which is a preterm baby. And they were actually higher mortality rate in about almost 1.6 relative risk. And if you look at the red lines, there were preterm babies that were born before 27 weeks, and they actually had a ×4 mortality rate. Now, looking at low birth weight babies, not necessarily preterm babies, but babies that are born below 2.5 kilos. And these babies, we already know that a baby that is born below 2.5 kilo have a relative risk of having stroke, diabetics, and hypertension later on in life. So this study was looking at their epigenetic age. And as you can see here, in the graph, and the epigenetic age was being checked when they were 3 years old. So you can see here that the blue dot is the babies that were born above 2.5 kilo. The red line is below 2.5. So babies that are born small, low birth weight, below 2.5 kilo had actually accelerated aging. And that was by Illumina, the Harvard clock. So when you see all this data, you kind of wonder, when does the longevity journey begin? So it all started, the first person, actually a professor, Barker, who was a doctor and an epidemiology, was published, the first publication was in Lancet in 1990, and he had his, what we call now a Barker hypothesis. He was looking at these babies that actually during the pregnancy, they kind of suffer from different environmental exposure, whether it's maternal hypertension or other something in the environment that caused them intrauterine growth retardation. So they were born actually very small, not really good nourished. But then in the NICU, we were always trying to do the catch-up, or, you know, all the mothers are always trying to give a lot of food to the baby so he will grow and he will be fat and looks healthy and good. So what happened with these babies is 20 years later, 30 years later, we saw that they actually suffer from metabolic syndrome. They have hypertension, lipidemia, obesity. So that started what we call the Barker hypothesis. And we actually, I have to tell you, when I started, and I was in the NICU like 25 years ago, when I was a resident, we were actually giving a lot of high caloric nutrition for preterm baby, especially the one who were born very small. And nowadays, only in the last decade, not really long time, not from the 1990s, it took a while, that we really have dietitian and very accurate about what kind of food we are giving to these preterm, a special amount of, not to exceed the fat, the protein, and the glucose. But this was the first time that the programming intrautero was starting to get into the head and the idea of the whole thing. And then it continued to develop. And in 2004, Gluckman and Hansen published what we call today is the development origin of health and disease, the DUHAD theory. And they actually brought the idea of reprogramming and developmental programming. So we know that epigenetic and the way that we talk about genes that are affected from environment was already presented in 1940, but they actually started to talk about the reprogramming and what's going on the same time that all our actually organs being developed. So when we are thinking again, when do longevity start? When it all began? In 2025, just this year, a huge review on pediatric research was looking at epigenetic changes in different stage of our life. And they were looking of all the articles that were, and the papers that were checking the epigenetic changes during lifetime, and started, of course, with the environment and with the before we even created. So we start with the mom. And there are a lot of evidence that, first of all, even before the pregnancy, we know that IVF by itself cause some epigenetic changes and methylation changes in different genes that are connected to appetite, to muscle. And we also know that in IVF there is some increase in congenital malformation, around 0.51%. And then when we go and look at the pregnancy, so we see, we know that maternal hypertension, for example, during pregnancy, there is changes in methylation in RAS activity, and we know in other different sites of CpG sites that later on connected with adulthood hypertension of the babies that were born to a mom that had hypertension during delivery, during pregnancy. Infant of diabetic mother, we do know that the during pregnancy, when the mother has diabetic, there is a lot of metabolic changes that create in the baby itself, in leptin, in adiponectin region, and these babies, the babies that are born to a maternal diabetic, they have higher obesity, higher chance of diabetic 1 and 2, and more obesity. And of course, we all know that all the drugs that the mothers are taking, especially, of course, if it's cocaine or any other exposure, or marijuana, they do have effect on the baby and especially on attention skills. So this was regarding what we know about in the methylation, but there are still, of course, other environment changes that the fetus during the programming can suffer from. So let's talk about nutrition. So the nutrition, of course, the effect starts when the baby is born, before the delivery, the fertilization time, all the organogenesis, all the fetal programming already being done at the very first week of from the conception. Of course, continue to the baby, infancy, and then adulthood. At every step of the way, the mother, the baby, the infant, and the child are exposed to different environmental and nutrition aspects. And let's a little bit dive in. What are the effects of the nutrition? So a nice study was being done with the dyad of mother and babies. They took 169 pairs, and they were looking on the mother nutrition, macro and micronutrition, and the epigenetic age of the baby. And what they showed here, that if the mother nutrition was with high fat, especially saturated fat, they checked the baby epigenetic clock, and they did it in cord blood and then also in the infant itself with the buccal from the saliva, the buccal cells. And they saw that the babies from the mother who had actually bad diet had epigenetic age acceleration by 6 to even 25 weeks. And then the opposite, if the mom has good vitamin D intake, so it was with lower epigenetic age. They also check these babies' aortic intima media thickness, which of course were the thicker it is, the worse it's not healthy for you. And they show that these babies with a higher epigenetic age has a thicker intermedia. For every week that they were accelerated by epigenetic age, the intima was thicker, and also they were actually more obese, more fat. Then there's a lot of studies that didn't show all of them, but we know that the micronutrients also affect a lot of the baby, the mother and the baby epigenetics, and studies show that good nutrition with polyphenol, vitamin D, B, fatty acid are, of course, good for the baby and slow the epigenetic age compared to high fat-saturated diet and not healthy diet goes with higher epigenetic aging. So that was when the baby is still in the womb, and the effect that we discuss about the DOHAD, the developmental origin of disease, already starts, as we showed, with epigenetic changes in the environment and reprogramming what later on is our lifelong years. And then the baby is born. So what is the best nutrition? So of course the best nutrition, and every pediatrician and everybody knows, is breast milk. So the beneficial of breast milk is of course known to everybody. I will just repeat it, but first of all to the mom itself, just breastfeeding improves postpartum depression and bleeding and weight loss, and also decrease the chance for ovarian and breast cancer and cardiovascular disease. So this is, of course, good for the mom. But if we look at the infant, so there's a lot of data and a lot of research regarding the infant itself that is less obese, less allergy, less ENT and hospitalization, less asthma, better microbiota, and higher IQ. So breast milk, of course, it's the first, the second, and the third recommendation for every pediatrician to a pregnant woman, to really the importance of breast milk. But when we look at how, but of course we actually recommend breast milk for 1 year. We can't live on breast milk all our life. So if we look at how babies, infant children are growing, there is if we look at the first year, and you see here the BMI curves. So the first year, a baby usually triple its birth weight. So if a baby is born 3 kilos, at 9 months, usually he should weigh about 9 kilos. So it's a huge increase in BMI. And then there is a decrease because usually the length is now growing, less the fat. So there is a decrease, and then we have an adipose rebound, which is for every baby, and usually it's around 6 to when the child is around 6 to 7 years. And this is a normal curve for BMI. What happened is, and studies show that if the adipose rebound actually starts before 5 years of age, this is a very high risk of babies, first of all, to be obese later on and develop metabolic syndrome. A really amazing study that was done on almost 1,000 babies. They were looking on a cohort of children that from birth until 30 years old, and they were looking on BMIs every 1 or 2 years and their epigenetic clock. And here they used 2 epigenetic clocks, the Horvath clock and the Grimm age. And they divided it to 3 different groups. One group, the first group, as you can see here, was a group that their BMI was good on the curves all the years from 0 to 30 years old. The second group was the one who got increase in their BMI, started to be obese at around 14, 15, like when they were in their adolescence. And the third group actually was starting to be obese from the beginning, so almost 30 years of obesity. And what they showed here, that if you can see the epigenetic clock compared to the chronological age, you see the first group that was with the good BMI the whole way, all along the 30 years, where chronological and epigenetic age was quite similar. The second group, the difference was accelerated epigenetic age, and the third group even higher. So what you can see here that being obese for a long time, like the longer you are obese, the worse you are actually prone to have more age accelerating, which is of course not good. And what they also measured here, the inflammation marker, and they showed here that the second and especially the third group had high inflammation markers such as highly sensitive CRP, leptin, and interleukin-6. So if we summarize the nutrition, we know and we showed that the nutrition affects, first of all, the mother during gestation, during pregnancy. What she eats goes to the baby and influence a lot of process and a lot of pathways that we actually encounter later on in life. And then the baby itself and the infant, what is the nutrition of the infant and child, and the obesity that if we don't take care of the the BMIs or the weight of our children during the beginning of life, there is an effect that creates also the process and pathways of other areas that we see later on as in aging. The second thing that, of course, there is a lot of environmental, but we focus now on nutrition, and the second is sleep. So sleep, of course, is the circadian rhythm starts, it's the relationship between melatonin and cortisol. Of course, the woman itself, when she's pregnant, she's exposed to light and dark, and then the melatonin, the cortisol, everything goes through the baby, through the placenta, to the baby, and also if there is a breastfeeding through the milk itself. But when the baby is born, actually they have no circadian rhythm, so they sleep 70% of the time, the first few weeks, and then, which it doesn't stay like this. I always tell to the mothers, sometime a mother came to me and said, he sleeps all the time. I said, don't worry, it will not stay like this. And then around 4 months, they start to arrange the circadian rhythm, and then usually at around 6 to 9 months, the circadian rhythm is actually well maintained. But this is normal. Actually, when we took, when the study that they took rodent and kind of disrupt the sleep pattern, the circadian rhythm, these mice, these rats develop cardiovascular risk and it decreased bone mass and strength and mood disorder. So sleep is extremely, extremely important. We know that there is lower cognitive performance for babies or that didn't sleep later on in life. And of course, also infant sleep has a huge impact on the mother depression. Several studies showed that we have strong evidence that this sleep is extremely important, and especially deprivation of sleep cause increase in adipose marker, high blood pressure, and insulin resistance. Studies on babies between 1 to 4 years, if they sleep less than 10 hours, and the recommendation is 14 hours at this age. So sleep deprivation do have overweight and obesity. And a French study looking at children from 2 to 5, they show that it's the shorter sleep duration, increased levels of inflammation markers. So sleep is actually very important. Now, this was all my one hat, which is a pediatrician. Now I move to the other side, which is the longevity in adults. And this is our longevity center that Professor Bishop actually told about it in our study, and the SHARP study that we are doing on participants, healthy individuals that are 50 plus, and doing all the tests. And of course, we do a lot of assessment. A part of it, of course, sleep and nutrition and bone mass and cognitive and everything. But I will just share with you some correlation that is actually important. So we did the heat map, looking on all the body composition, the cognitive, blood test, and physical performance. And what was interesting that we saw also in adults that who were the ones with the young biological age in all these 1,000 participants that we looked on so far. And we, as you can see here, low visceral fat, low BMI, weight circumflex, and good sleep, and less, this is obstructive sleep apnea. So participants that had good nutrition, not obese, low BMI, and good sleep actually had a lower biological age, which brings us the same as we found and we know in babies and infants. So what we are actually suggesting, and it is especially in a place like Mauritius, that's starting to see and look from a longevity perspective, that we all should start actually from the minute we are born. And we have to look on the life course medicine. We have to have an action plan from the beginning, how we do it. We have to make sure that the epigenetic predictor of age will be adjusted to pediatric and to develop biomarkers. It should start with the gynecology, that's what they are saying to the mother, and of course continue on with the pediatrician, and later on, of course, with family doctors, etc. And we already actually started a consortium regarding how to develop it. And we kind of suggest a life course longevity checkup. So this is the checkup that every baby is having worldwide, like vaccination, hearing, vision, BMI, and different checks, like a lot of checks, especially the first 2 years of life, but then until 18. And we suggest, actually, let's do a developmental for children that is really the windows of opportunity that I showed you, that we can actually interfere and actually prevent the reprogramming and prevent these epigenetic changes at a very young age. So we will not see all these epigenetic changes that we accidentally did when we were young, and then we see the later on effect, which might be not too late, but it will be much difficult to really change. So we actually just submitted a paper that looking and talking about how important it is to start from really early age, and to use these golden windows of opportunity and to really make a difference with the life course medicine. And hopefully our consortium, and of course we are ready to participate and collaborate and really start here. It is a really huge chance that if we, starting in Mauritius and longevity, to look at it from the beginning, to really prevent. Because I always say, it's never too late, as we say to every adult that come to a longevity clinic. Well, it's never too late, but I would add, and it's never too early. Thank you very much.
Thank you so much, Tzipi. That was excellent, thank you. One quick minor question from me.
Yep.
We fly a lot for this industry on the circadian rhythm. How damaging is that for our longevity?
The what, sorry?
We fly a lot from place to place.
Ah, okay, yeah. Well, if you're talking about the circadian rhythm,
yes, sorry.
It's not helping us, I have to say.
I thought you were going to say it's okay, don't worry about it. Okay.
We have to manage it.
Oh, actually, that's a great question. So, sleeping healthy habits advice how many hours? And the bit that I want to pick up on that is nap during the day.
Okay.
Is this okay?
Only 20 minutes, not
20
more
minutes.
than that. Yes, there are studies that show that if you nap more than 20 minutes, you're actually doing more harm than benefit.
Okay.
Now, the sleep is actually a very important component, actually in cardiovascular risk. They added it like, you need to have a Mediterranean diet, 150 minutes of sport, and they added 7 hours of sleep, like the minimum 7 to 8. Actually, 10 hours of sleep is actually also not good.
Okay.
So 7-8 hours of sleep. Sleep is extremely important. We have the glymphatic system. We have everything that needs to be done during our sleep and actually help memory and a lot of stuff. So 7-8 hours and not more. A nap, usually not necessarily a nap, but if you do a nap, don't do it too long. 20 minutes, it's enough.
But occasionally. So Nadine and Damien are going to sleep for 2 days when the event ends. Is that okay as a one-off? And the last question actually from me is technology and monitoring for babies. I mean, we're doing it obviously ourselves. Is there an age, time when you think this is of use? Or no?
I don't know. I mean, we need to start something and then to see what we can learn from it. I mean, the reason why we biohack and monitor ourselves all the time, for me especially, is to find out when is my good, let's say, score. What did I do to have this good score?
Yeah.
So then you try to learn patterns. And if we kind of hack our babies and try to learn the patterns, maybe we can have some more insight. So I wouldn't say no.
Okay, Tzipi, thank you so much.
Thank you. Thank you.